All right, well, thank you, Lori, and thanks everyone. And I agree with Lori too. I like seeing faces as well. Then I can tell who's dozing off or not. Lori's introduction was fine with me, unless Emily has anything else to add to that. All right, well, I want to again thank all of you for coming and thank Emily. Emily's done an amazing job on this part of the presentation as well. We met during the University of Washington Applied Animal Behavior Certificate Program, and her work was always really stellar, her knowledge, her intuition, and I'm really excited to work with her on a couple of projects. So with that, we'll talk about our outcomes for today. We have designed the webinar for the intermediate provider. So we are operating under the assumption that you already know the benefits and terminology of AAIs, though we will go over them quickly in the event that you are new to the field. So our outcomes today are really quickly to list the potential risks to the practitioner and client associated with unsuitable or highly stressed therapy dogs in session, describe how a solid understanding of dog behavior and humane training methods fit the paradigm of our competencies and standards, defining positive reinforcement training and describing the potential risks to the practitioner and the client using aversive methods, and applying basic principles of operant conditioning to teaching cues, etc. So you can read them there. So we know the benefits of including dogs in practice because you're here. So you've already seen them, you've already experienced them, and regardless of the type of clinician that you are or will be, including dogs can help us reach the goals of our clients that we may not have been able to meet otherwise. We often sit on the periphery of healing or growth, and there are thousands upon thousands of stories about how dogs have helped us with that extra push. Because dogs are social and non-judgmental, and they have a desire to please, they are natural therapists. And for our counselor friends, all dogs have read Carl Rogers. They are genuine, open, and have unconditional positive regard. Clients often want to tell things to our dogs that they might not tell other humans or even us. Patients might be more motivated to use a scooter board if they are moving toward a dog to give them a treat. Melissa taught me that. There is evidence that talking to a dog and touching a dog can release oxytocin, which in turn reduces cortisol or reduces stress. So the help of humans by dogs is wonderful, but we have to be careful about maximizing the human benefits at the expense of the dogs. The benefits to humans should not come at an expense, emotionally or physically, to the dogs. We get to decide as practitioners to go to school, to get our licensure, but dogs don't. We want to make sure that dogs don't merely tolerate the work, but they enjoy it. This can be a controversial topic among certain circles, because how do we know if a dog enjoys it? They can't really tell us, but we can, by learning their first language, body language, that we at least have a pretty good idea and hopefully objective idea of what they would rather be doing, or if they would rather be doing that. So terminology matters. Melissa will recognize this as well. There's a lot of work being done in this area as far as ensuring that we all have a universal terminology, a uniform terminology. So whether you're conducting animal-assisted activities, animal-assisted therapy, animal-assisted education, the dog's welfare matters. It's crucial for us as a field to ensure we are using appropriate and consistent terminology, and every specialization, every profession has a shared uniform terminology, so this field should not be any different. So I won't go over them in detail because a lot you can see right here, but just knowing that animal-assisted interventions is the umbrella term that encompasses animal-assisted therapy, animal-assisted activities, and animal-assisted education. They are goal-oriented and structured interventions for a human service professional. You can hear my neighbor's dog next door. Or educational field for human therapeutic gain. Those who provide animal-assisted intervention should have adequate knowledge and experience related to animal behavior. Therapy, animal-assisted therapy, is structured, goal-oriented, and again, documented, conducted by a licensed human service professional or educator, and is conducted within the professional scope of practice. The practitioner is facilitating the change. And animal-assisted activities are informal activities, often volunteer visits with a therapy dog team. The human-animal teams have appropriate training, and the dog has been evaluated by a reputable registering agency. who evaluates their dogs yearly or at least every other year. And then animal-assisted education, also goal-oriented structured activity with documentation provided, conducted by an educational or similarly service professional. Emphasis is on academic goals, improving social skills, and conductive or cognitive functioning. Sorry. And again, these are loose definitions. There are more detailed definitions, and you'll get to read about those sometime soon. So what does this have to do with dog behavior and training? So moments like these, this is one of our youth in our program. Sorry, my dog's going out the window. So moments like these, again, one of our youth and our dogs in our program, where we pair adjudicated youth with harder to adopt rescue dogs. We spend a lot of time focused on the dog's body language, especially in our work because we work with rescue dogs, that we have to be very, very aware of how the dog is feeling at all times for the resident's sake and for the dog's sake and for our sake. And really that's no different even in practice with our own dog. So we want to go where the dog is. Is the dog nervous? Is the dog rambunctious? Is he feeling over-aroused in some way? And how can we help alleviate that? By teaching our youth how to recognize what the dog might be feeling, their compassion and empathy are fostered, which triggers their growth. But for dogs, in our case, they become more adaptable. I think it's fair to say that we want this field to be strong, have integrity, and to be legitimized. In order to do that, the field needs to be unified and to adhere to ethical codes and standards. There is no overarching body at this time to accredit or monitor the practices of clinicians, so the onus is on the practitioner, on all of you, on all of us, to make sure that we are becoming educated to any new theoretical orientations, practices, modalities, or techniques. When there is no formalized education or training, we as the practitioner have to seek out applicable training, such as this today. This tenet of non-maleficence or do no harm is listed in every professional licensing organization. This also extends to our animals as well. If we are intentionally or inadvertently harming our animals, and in our case dogs, we are sending negative and potentially harmful messages to our clients. So as the field evolves, guidelines are established. In order for us to remain within our scopes of practice, we have to have a set of competencies and guidelines to follow. All professionals have this code of ethics or a code of ethics, and this field, again, is no different. Because we are proficient as OTs, PTs, counselors, or psychologists does not automatically mean that we're proficient in conducting AAIs. A key component in all current codes of ethics is adding a solid knowledge base of animal behavior at the species, breed, and individual level. So whether you're looking at these code of ethics or you're looking at code of ethics for AAIs and other fields, they will all have this same need to be proficient in that area of animal behavior. The first professional code of ethics for AAIs as an adjunct to therapy was published in 2016 by the American Counseling Association for counselors who integrate therapy dogs into practice. Animal Assisted Intervention International has a set of thorough standards and guidelines for clinicians, handlers, and therapy dogs. And this very section, the APA HAI Section 13, recently published a code of ethics for psychologists and mental health providers, which is posted on the section's website. The American Occupational Therapy Association also has similar competencies in the works. Within all of these documents, the need to protect the well-being and ensure optimal welfare for the animals is of the highest priority. Many will argue that the needs of the clients must come first, but as the only advocates that our dogs have, we have to advocate for them first. If dogs are experiencing stress, distress, fear, uncertainty, and we are not keenly attuned to reading our dog's body language and identifying signs of stress, we are increasing the likelihood for potential injury or other negative experiences for our dog and for our clients. If the dog cannot trust that we will take care of them, it may also mean that they no longer feel safe, that they cannot trust that we will be there for them, or that they will not feel safe in the clinical setting. They trust us, they need to be able to trust us, and learning to speak their language will help with that trust and foster a stronger relationship. And Emily will talk much more about that later. Additionally, when training our dogs to work in therapeutic settings, using more humane methods will strengthen the relationship over punitive methods, such as using shock or prong collars to train, which also Emily will talk about. So the use versus exploitation. This is a big thing. You know, we don't use our dogs, we work with our dogs, we integrate our dogs, we incorporate our dogs into practice. And Zamir, he writes a lot from a liberationist standpoint about the word use, using the dogs. So basically he says that X uses Y as a means of furthering X's own financial or other well-being. This turns into exploitation when X is willing to act in a way that is substantially detrimental to Y's own well-being. So in other words, we could say a clinician, being X, clinician uses a dog when the clinician perceives the dog as a means of furthering his or her own financial well-being. This turns into exploitation when the clinician is willing to act in a way that is substantially detrimental to the dog's own well-being to further the clinician's own. Can we honestly say that the dog wants to be there? Does the dog want to be with you? Does the dog want to be in the office? Does the dog want to be with your client? This happens, and we just need to be aware. Studies of working dogs, specifically guide dogs and explosive search dogs, and these are the groups that the studies came from, the Deference Science and Technology Lab and the Institute of, I missed that part, the Anthrozoology Institute, that's the word that's missing there, Anthrozoology Institute in the University of Bristol. They determined that basically stressed dogs perform badly during training and concluded that a happy dog makes a good worker. And while they are referring to specific working dogs like service dogs or dogs who are sniffing out dangerous explosive, stress is stress. And a dog experiencing chronic stress without relief or advocacy from his handler will result in chronic stress. And chronic stress can be the same. So it's chronic illness, weight loss, newly developed anxiety, etc. So there is a fine line. So basically we're just saying, is the dog uncomfortable? How do we know if the dog is uncomfortable? How do we know if the dog is enjoying his work? They can't tell us, or can they? They can tell us in their own way. And Emily now will talk to you about how we can be objective observers to our dog's behavior so we can best maintain their welfare. Emily, it's all you.
Thank you, Amy. So learning how to observe and describe dog body language is incredibly important to ensuring that therapy dogs are experiencing positive welfare, which is something we're going to talk a little bit more about soon. An observation describes what the dog's body is doing in a given moment. On the other hand, an interpretation is a hypothesis about what's happening inside of the dog. It can be like a guess of what an observation means. And our personal biases about our dogs can also impact their welfare. For example, when we hug our dogs, our biases might lead us to believe that our dogs are always enjoying it. So it's important to recognize these biases and how they may be influencing our interpretations of our dog's behavior. We can make better welfare decisions for our dogs when they're based in objective observations rather than subjective emotional interpretations. One danger of interpretations is that they often lead us to labels that don't serve us or the dog. For example, some people might see this photo and say that the dog is stubborn. But when we pause to truly observe dog body language while also considering the context that the dog's in as well as the individual dog, we then open the door to having a better understanding of our dog's behavior and welfare. I do want to acknowledge that it's impossible when working with dogs to always avoid making interpretations about why they do what they do. But there are two important rules that I want you guys to remember when making an interpretation. So number one, base your interpretation off clearly defined observations. If you're going to make a case for why a dog is stubborn, be prepared to explain what specific measurable observations led you to that interpretation. Rule number two, be transparent with yourself and with others when you're making an interpretation about dog behavior. Another danger of interpretations is when they're sold as fact. There have been a lot of interpretations about dog behavior over the years that have led to widespread misinformation. So try to use observational descriptions of dog behavior and body language as much as possible. So in making observations about dog body language, there's a few things that I'd like you guys to consider. We must look at the whole dog. It can be easy to hone in on one aspect of the dog, and many of us are taught from a young age that the dog's tail holds all of the answers to how they're feeling. You know, if it's wagging, the dog is happy, and if it's tucked between their legs, they're scared. Firstly, tails are so much more complex. They say so many more things. And secondly, there's an entire body attached to that tail that's also displaying important communicative signals. So don't just look at the tail. Look at the ears, the eyes, the muzzle, the position of their head, the position of their body, etc. There's so many other signals that we can look for. So let's take this dog, for example. These photos were all taken within a few minutes of each other. But look how different his tail is in these photos. Look at the heights in which they're held. Look at where his ears are positioned. Look at the subtle differences in his eyes in these photos, and the changes in his furrowed brow, and even in the tension in his facial muscles or in the muscles in the rest of his body. The dog's breed is also something to consider when making observations about dog body language and behavior. Breed can influence where dogs naturally hold their tails, or even if they have a tail. Some dogs obviously have naturally floppy ears, while some have erect ears. It can be more challenging to notice certain subtle signals depending on what the dog's body looks like, especially if they have maybe a fluffy coat. We can take practice and experience with these various breeds to get to know their specific signals. Breed and genetics can also influence dog behavior. And as Amy mentioned earlier, educating yourself about your dog on the species, breed, and individual levels is very important. We should also take into account the context that the dog is in. For example, a growl can mean different things depending on the context. A growl during play is different than when, a growl when someone approaches their favorite bone, or if a dog growls when someone touches a painful area. So consider what's happening in the environment that might be influencing their body language and behavior. And finally, it's incredibly important to consider the individual dog in front of you. Some dogs have individual quirks, so it's important to be cautious in making sweeping generalizations about things like behavior and body language. And by getting to know the dog that you're observing, you'll learn what contexts tend to make them fearful and which they're relaxed in. You'll get a sense for what their baseline is. However, just like humans, what a dog is comfortable with can vary day to day, even minute to minute, depending on several factors. This is why it's so important to always monitor dog body language, no matter how well you know the dog. Keep in mind that photos are simply snapshots of a moment in time and might not be a true representation of what the dog is feeling in that moment. Looking at dog pictures can be great practice in building your dog body language observation skills, but remember to be cautious in making interpretations, especially based on a picture alone. As you start to feel more comfortable observing dog body language in photos, watch videos of dogs to see what you can pick up on. And then finally, for the ultimate dog body language practice, and if it's safe to do so given COVID-19 where you're located, I recommend heading to the dog park and watching dogs play and interact with each other and humans. It's actually very fascinating when you're kind of looking at dog body language through this lens. So Fear Free is a fantastic organization with great resources for animal professionals and guardians. All of their content is approved by veterinary behaviorists, and so I highly recommend checking them out. They created this great infographic on the spectrum of fear, anxiety, and stress in dogs, and I have it broken up here into 2 slides. I want to go through it to give you an overview of dog body language and communication and what you need to look out for, especially during AAI sessions. You'll see that each category is given a color: green, yellow, red, and an FAS level. FAS means fear, anxiety, and stress. These colors represent traffic lights, so green means the interaction can continue. During AAI sessions, you want your dog to be at an FAS 0, or in the green zone. Some signals you'll see in the green zone include soft brow and soft eyes, a relaxed mouth. Their tail will be kind of held at a neutral position, like you see here on the slide in B, and like the dog B. And my favorite green zone behavior, I think, is the slow back and forth, full tail and butt wag. That's one of my favorite things to see a dog do. So during AAI, you may occasionally observe mild stress signals that may be an FAS level 1, such as lip licking, turning their head, or avoiding eye contact. These signals are very common during social interaction, so I might not necessarily intervene at level 1, especially if the dog has the ability to move away if they want, which is something I highly recommend. But at the very least, be sure to continue observing the dog for any escalation and fear, anxiety, and stress. Yellow means that caution is required and changes need to be made to prevent further escalation. Some stress signals you'll see in the yellow zone include their ears starting to go slightly back or to the side, a low tail, panting with a tighter mouth. They might refuse to take treats, or they might take treats more roughly. The signals you'll see in the red zone are going to vary depending on the dog and the context. Some dogs might respond to significant stress with fearful flight or freeze behaviors, and other dogs respond to stress by aggressing. The red zone means that the interaction needs to stop immediately. If your therapy dog displays any FAS 4 or 5 behaviors, remove your dog from the situation and end your dog's workday. Especially if these behaviors are new for your therapy dog, they should be medically evaluated by a veterinarian. If no medical causes to the behavior are found, consult with a behavior professional before your dog returns to their work. You should also notify the organization that your therapy dog is registered through, because they might want to also conduct a behavior evaluation. And Amy has a few thoughts she wanted to add here.
Yeah, I just want to add to what Emily said, that in most cases, a dog that has been through training to be a dog in this environment, they've been evaluated and registered, they might be less likely to exhibit the red behaviors, hopefully. However, as dogs age, their preferences and tolerances may change, which is why it's really important to have your dog evaluated at least every other year. So just to reiterate, it's why it's important and part of the ethics and competencies to understand the dog body language, again, at the species, breed, and individual levels. It's the misreading of behaviors or disregard of the signs of stress that increase the risk of injury and negative effects. So that's all I wanted to add.
Thank you, Amy. So there are many factors that influence our dog's behavior. Genetics, what they were exposed to during their sensitive socialization period, and so many more things. Today, we're going to explore the influences on behavior that we have the most control over as their guardians and as AAI professionals, their learning experiences, and the environment. We're going to do just a very brief, simple overview of how dogs and all animals learn. The primary ways that they do so are through consequences and associations. When dogs learn from the consequences that immediately follow their behavior, this is called operant conditioning. When dogs learn associations between things happening in their environment, this is called classical conditioning. It's also known as respondent conditioning or Pavlovian conditioning. Dogs are learning all of the time. Operant conditioning and classical conditioning happen without us knowing it or intending it to. While we often talk about operant conditioning and classical conditioning as two different ways of learning, they often occur simultaneously. So for the sake of time, I won't be going into more detail about classical conditioning, but we'll quickly review operant conditioning. A well-respected expert in the field of animal behavior, Dr. Susan Friedman, says that behavior is a tool animals use to produce consequences. This means that all behavior has a function. To put even more simply, dogs do what works. They do what works to get them what they want and need, like food, social interaction, enrichment, and safety. This photo is a very simple a simple example of a dog doing what works. So dogs beg at the table because at some point it has worked to get them food. And because food is a very powerful reinforcer, it doesn't even have to happen very often for the dog to continue begging. So take a moment to consider what behaviors work for your therapy dog. Consider the consequences of those behaviors. Here's a very simple graphic that breaks down operant conditioning in a way that's very easy to understand. As I mentioned before, operant conditioning is when an animal learns by the consequences that immediately follow their behavior. To understand operant conditioning, we must first learn our ABCs. What triggers a behavior to occur is called an antecedent. Examples of antecedents include hand signals, verbal cues, environmental cues, and you'll see some fun examples here on the slide. In operant conditioning, one of 4 possible consequences follows a behavior. There's positive reinforcement, negative punishment, positive punishment, and negative reinforcement. Animal trainers often refer to these as the 4 quadrants. You might also hear them called contingencies. In the case of these consequences, positive and negative doesn't mean good or bad. Positive means something was added, and negative means something was removed. Reinforcement refers to the increasing of a behavior, whereas punishment means decreasing the likelihood of a behavior occurring again. So looking at this infographic, you'll see that it refers to the good stuff and the bad stuff. If you were to open up a textbook on psychology or applied behavior analysis, you're probably not going to see them talking about good stuff and bad stuff. But instead, you might see them use terms like an appetitive stimulus or an aversive stimulus. An appetitive stimulus is something that animals work to receive, whereas an aversive stimulus is something that the animal works to avoid or escape. So let's look at an example of operant conditioning so we kind of see these 4 quadrants playing out and how you would change behavior. So if you wanted to teach loose leash walking with positive reinforcement, you would then, when the leash becomes loose, you would give the dog a treat. So then the loose leash walking behavior increases in the future. If you wanted to teach this behavior with with negative punishment, anytime the dog pulls ahead, you stop moving. Getting to move in the direction the dog wants to go in is the good stuff in this scenario that you are then removing. So this decreases the pulling behavior. If you wanted to use positive punishment, when the dog pulls, you would apply a leash jerk, which would decrease the pulling behavior in the future. If you wanted to use negative reinforcement, when the dog pulls, you'd apply leash pressure and not release the pressure until the dog walks loosely on leash. This increases the behavior of loose leash walking in the future. Negative reinforcement is one of those, one of the quadrants that I see that are often used incorrectly, by the general public. And so a little trick that kind of helps me quickly pick out when something is negative reinforcement is if the dog experiences relief during the training procedure. So there are a few things to keep in mind when thinking about the 4 contingencies. The animal decides what is reinforcing or punishing. This means that you can't truly know if you've used a particular consequence until the next opportunity the animal has to perform the behavior or not. So using the leash walking example, there are plenty of dogs who continue to pull on leash despite their guardians giving leash corrections. But I mean, it's not really a leash correction if it's not correcting the behavior. Positive punishment and negative reinforcement aren't happening. If positive punishment was happening, the pulling would decrease after the leash jerk, by definition. If negative reinforcement was happening, the loose leash walking would increase after the leash pressure was released, again, by definition. This is likely because there's something more potent than the leash pressure that's reinforcing the pulling, like getting to sniff, getting to see other dogs, getting to go to the park. Unfortunately, this can result in some people then escalating the leash jerks, doing them harder and harder until the pain or the fear that they cause becomes the more potent consequence than the dog getting to sniff or the dog wanting to go to the park. As many of you guys know, this happens to us humans too. We're often put in these kind of conflicting situations. And I'm gonna share an example, a personal example. I'll be a little bit vulnerable with you guys. So I'm pretty anxious about driving on the interstate highway here in the Seattle area. But getting to where I need to be is often the more potent consequence. So I'll push through that anxiety and I will drive, unless it's rush hour. And then my fear of dealing with rush hour on I-5 becomes the more potent motivator. So I avoid driving during that time. That doesn't mean that when it's not rush hour, that I'm not anxious when I'm driving on I-5. And it doesn't mean that my welfare isn't negatively affected by that anxiety when I do drive on the highway. So I try my very best to decrease the fear and anxiety in the animals that I work with. I try to decrease the risk of this happening. So because of this, I avoid the intentional use of positive punishment and negative reinforcement. But because the animal decides what's reinforcing or punishing, it's possible that even when I intended to positively reinforce the behavior, if the behavior then decreases, that means it was positive punishment. So if that happens, then I'll immediately assess how and why in order to prevent it from happening again. It's very beneficial for animal-assisted intervention professionals to have at least a basic understanding of how dogs learn. Operant conditioning and classical conditioning are happening all of the time, whether we intend them to or not. Our dogs and ourselves, we're always learning. What they're learning at any given moment influences the dog's future behavior. So being able to recognize the antecedents and the consequences that your dog is experiencing when they're behaving is the key to knowing how to change that behavior. Understanding how dogs learn can help you teach your dog more efficiently. But perhaps most importantly, you can ensure that you have the knowledge and skills to train your dog in a way that builds trust rather than breaks it down. Trust is essential to any relationship, as I know all of you here know, including those between humans and other animals. But with your therapy dog, trust is critical. If your therapy dog has any reason to feel unsafe, that's not only damaging to the human-dog bond, it's also a liability. So we're going to shift gears a little bit to discuss how our dog's environment can influence their behavior. This is my dog Ayla at the vet, where her behavior is most definitely influenced by the environment. As we progress through these next few slides, consider how different environments affect your dog's behavior. While dogs have the same basic senses that we do, they experience the world through these senses very differently than humans. Humans are very visual animals, whereas dogs see the world through their noses. Their other senses may also be less sensitive or more sensitive than ours. So because of this, the environment can influence their behavior in ways that we might not be able to perceive. Here's a photo of a college campus, a common place for dogs to work. Take a moment to think about the potential stressors in this environment and that your dog might be able to see or smell or hear or feel, etc. You're welcome if you guys want to kind of share amongst yourselves in the chat what you think the dog might be experiencing in this environment, and I'll share the answers on the next slide. So I'll give you guys just a second, and I'm gonna take a drink of water, take advantage of the pause. Okay. So as you can see, there are several things that could be influencing your dog's behavior in these kinds of environments. There might be things that they're noticing that we don't or that we can't. So for example, they might be noticing the barometric pressure from changing weather patterns. Dogs might also notice squirrels and birds and other animals to chase that we aren't even paying attention to. They might also find things like bulky purses or bags or hats and sunglasses to be scary or worrisome. The temperature on the sidewalk could be uncomfortable or even painful if it's really hot or cold. Dogs might also be more sensitive to or worried about sounds such as the flapping of the flag, the buzzing sound of the light that you see here. They might also be more sensitive to the alarms, the elevator bells, and the dings, and all of the other things that are often heard on college campuses. And finally, dogs are most certainly smelling many things that we can't. Some of which might be distracting, like smells of food or other animals. There might also be smells like cologne, perfume, cleaning supplies that might be even kind of aversive to dogs. So considering how the environment may influence your dog's behavior is important for animal-assisted practitioners it's important for you and your dogs. So I encourage you to contemplate the answers to these questions. What environments is your dog working in? What occurs in that environment that your dog may be more sensitive to than you are? What might they smell, see, hear? What might they touch, or who or what may touch them? Next time you're in those environments, use your knowledge of dog body language to know how your dog responds to that environment. Are there changes that can be made in that environment to help your dog feel more comfortable in it? And if so, what are they? Your therapy dog's learning experience, as well as the environment, can directly impact their welfare. First and foremost, it's important to point out that welfare isn't synonymous with animal care or animal husbandry. Animal welfare refers to the state of the animal on both a physical and mental level. It's the experience of the animal and how they're attempting to cope with their environment. And while these are subjective experiences for the animal, it's important that their welfare is objectively assessed. So some of you might have heard of the 5 freedoms. For a very long time, this concept has been considered the animal welfare standard. The freedoms consist of the freedom from hunger and thirst, freedom from discomfort, from pain, injury, or disease, the freedom from distress or fear and distress, and the freedom to express normal behavior. An interesting thing to point out is that the 5 freedoms can only be minimized. They can't ever truly be eliminated because they're necessary in eliciting behaviors required for survival. For example, if animals didn't feel hunger and thirst, they wouldn't be prompted to eat and drink when their bodies require it. In 2016, Dr. David Meller proposed some alternative ways of assessing welfare that really incorporates the depth of the current knowledge about animals. He also points out that minimizing negative states that the freedoms really focus on doesn't inherently create positive experiences. So he recommends focusing on the provisions rather than the freedoms. And he also added animal welfare aims. One that's especially important, I think, is provision and aim number 5, positive mental experiences. It says to provide safe, congenial, and species-appropriate opportunities to have pleasurable experiences, and to promote various forms of comfort, pleasure, interest, confidence, and a sense of control. So consider if and how this and the other items on this table can be implemented in your therapy dog's life and work. Are there things that you can do that will promote comfort in their lives? Or are there ways that you can give them a sense of control over their environment? For those of you that are interested in kind of systematically assessing animal welfare, Meller created this very, very, very thorough science-based structure for doing so. The purpose of each of these domains is to draw attention to relevant areas in welfare assessments. And it not only includes assessing and grading welfare compromises, it also examines welfare enhancements. So if you're interested in objectively assessing animal welfare and the work that you do, I highly recommend you read more about the 5 domains model and how it can be utilized. Historically, the focus of animal welfare science has largely been on determining how to minimize suffering and avoid negative states in animals. But this doesn't inherently create positive welfare. As you've seen in Dr. Meller's models, creating positive welfare requires us to go beyond satisfying the basic needs of the animal. Positive welfare includes providing animals with opportunities to have positive experiences. It considers their preferences and their motivations. So in focusing on promoting positive welfare in therapy dogs, we can ensure that therapy dogs aren't merely tolerating their work, but enjoying it, as Amy said earlier. In order to promote positive welfare in therapy dogs, their welfare must be attended to before, during, and after therapy sessions. Dogs, just like humans, have a metaphorical emotional cup. There are various things that refill your dog's cup, like getting to do dog things, sniffing, foraging, playing, etc. There are also things that empty it, like the lack of enrichment or a lack of stimulation, or putting the dog in challenging or scary situations. Some signs that your dog may be coping with an empty cup include overreacting or shutting down when they're exposed to new things, or maybe they're slow to recover from exciting events. You may also notice some overlap in this graphic with Dr. Meller's provisions, welfare aims, and domains. Because therapy dogs may be exposed to environmental and social stressors during sessions, ensuring your dog is having their needs met and having positive experiences can keep their cup full and promote positive welfare during sessions. We discussed earlier the importance of taking into account your dog's sensory and emotional experiences, and to always watch their body language to ensure they're experiencing positive welfare, especially during AAI contexts. A few additional, more specific ways to do so for your therapy dogs include giving your therapy dogs access to water during sessions, making sure the temperature of where they're working is comfortable for them, giving your therapy dog breaks between sessions, allowing your dog to explore new, unfamiliar environments before being introduced to new people. And outside of sessions, therapy dogs should be given enrichment opportunities like food puzzle toys and decompression walks. I'm a really big fan of decompression walks. Basically, they are walks in outdoor spaces, either in off-leash areas or on a long line attached to a back clip harness, where the dog can simply go at their own pace and sniff as much as they like. Another very important way to promote positive welfare is to give your therapy dog more choices and control in how they interact with humans and the environment. One way to do this is to have AAI sessions where the dog can be either off leash or on a long line attached to that comfortable back clip harness. Another way to do this is to encourage the use of petting consent tests in the people who want to pet your dog. Here's a little bit of information about petting consent tests and why you should be doing them. I'm a very big fan of petting consent tests. So when petting a dog, remember to stop frequently to see if they're enjoying it. When you do stop petting, does the dog try to reinitiate petting by moving closer to you or placing themselves under your hand? If so, that's great, you can continue petting. On the other hand, if when you stop petting, does the dog try to move away or do they look away? Do they display other stress signals or do they duck their head? If so, stop and give the dog some space. I then recommend waiting to pet the dog again until they elicit attention from you again, until they're ready to continue that social interaction. I love this because when we teach our dogs that we will respect their nose, that we will respect the consent that they're offering or not offering, we build trust, which, as I mentioned earlier, is essential to not only your relationship with your dog, but how comfortable your dog is when they're interacting with other humans. So purely preventing negative welfare ensures that animals survive, but promoting positive welfare allows our animals to thrive. As we touched on in the last few slides, encouraging positive experiences and minimizing negative experiences is critical to your therapy dog's welfare. It's important to be able to objectively assess positive and negative welfare, which further supports the need to have excellent dog body language observation skills. If you do find that your dog is experiencing negative welfare, you should have the knowledge to identify what's causing it and how to remedy it. You should also know when and who to ask for help, like a veterinarian or a behavior professional. Knowing how the environment influences your therapy dog's behavior and welfare is also very insightful. And finally, understanding how dogs learn can further assist you in identifying what's impacting your dog's behavior and welfare, and it can also give you the tools to change their behavior. So this is where dog training comes in. Minimizing our dog's negative experiences and promoting or encouraging positive experiences to promote positive welfare includes how we train and interact with our dogs. Methods and tools such as prong and shock collars that utilize positive punishment and negative reinforcement work by causing our dogs to experience something aversive. Dogs then change their behavior in order to escape or avoid that experience in the future. If positive welfare is our goal, we must avoid these methods and instead make training a positive experience. Positive reinforcement training works by causing our dogs to experience something that they enjoy, something they desire. Dogs then change their behavior in order to have that experience again in the future. So this is the foundation of humane reward-based dog training. There have been several studies in recent years demonstrating the negative effects of aversive dog training methods. particularly positive punishment and negative reinforcement. These effects include an increase in fear, aggression, and other behavior and psychological problems. There also have been some injuries documented as a result of using these methods, and due to the effects that stress has on physical health, these methods could increase the likelihood of other physical health issues. Some trainers claim that using both rewards and corrections, or positive punishment and negative reinforcement, is the ideal way to train. Sometimes you'll hear this referred to as balanced training. Studies have shown that even when also using positive reinforcement, if you're still using positive punishment and negative reinforcement, there's still a correlation with an increased risk of fear and aggression. So methods to reduce risk of harm must be a priority in AAI. A therapy dog who is fearful or aggressive is a risk to themselves, the AAI professional, and especially the client. And remember, dogs are learning all of the time. So even if you're not having an official training session, even if you're just interacting with your dog, operant and classical conditioning are both occurring. So if you or someone else treats your dog in a way that causes them to feel pain, fear, or discomfort, your dog could potentially develop a negative association with that person and potentially the environment or the context that they're in. This can be especially risky for therapy dogs who need to feel safe with a variety of people and in a variety of places. Some studies have also demonstrated that aversive methods may be less effective than reward-based methods when teaching new behaviors. In fact, there was a study that was published exactly a week ago that compared the use of shock collars with positive reinforcement training. The trainers in the shock collar group were actually nominated by the shock collar manufacturers. So you can assume that these were the best of the best from their standards. The study found that reward-based training was significantly more effective than aversive training methods. The researchers concluded that, and this is a quote, "Dog training with these devices causes unnecessary suffering without good evidence of improved outcomes." Despite everything we know about the risks caused by aversive training methods, there are several barriers that have prevented the adoption of humane reward-based methods. Studies in the last few years have demonstrated that many dog guardians and even professionals continue to use aversive training methods, specifically positive punishment and negative reinforcement. One of the most significant barriers is the lack of regulation in the dog training industry. While there are various membership organizations for dog trainers in most countries aren't required to have specific credentials, education, or experience in order to call themselves a dog trainer and charge for their services. Because of this, misinformation about dog behavior and training is still pervasive. So when you're reading about dog behavior online, or anytime you're consuming information about dog behavior, or maybe you're looking to hire a dog behavior professional, consider their education and their credentials. Are they honest and transparent about what methods they use? Here's something that I often share with people who are looking to work with a dog trainer or behavior professional. Be sure to ask exactly what will happen to your dog if they get it right. Ask the trainer what exactly will happen to your dog if they get it wrong. You can also ask if there are less aversive alternatives to what they propose. If you're uncomfortable or unclear about their response, if they don't really tell you exactly what's going to happen, keep searching. I'm sorry if you hear my cat meowing. She's around my feet talking to me. While it's important to be aware of the risk of using aversive training methods, I want to highlight the benefits of using humane reward-based training. Studies have shown that dogs taught using positive reinforcement are better at learning new tasks. Dogs are also more motivated to train, making reward-based training a form of enrichment that promotes positive welfare. Dogs trained using positive reinforcement are also more well-behaved, according to various studies. Reward-based training is also safer for both dogs and their guardians, and dogs trained with these methods are less likely to be aggressive towards family members and unfamiliar people. Studies have also found that humane, reward-based methods are associated with better relationships between dogs and humans, which is essential to AAI. So I just want to take a quick moment and say that if you are using aversive training methods to train your dog, or even if you have in the past, I'm not here to judge you or to make you feel guilt or shame. I also used to use these methods. But as I mentioned, we're constantly being exposed to misinformation about dog behavior and training. We're all doing the best we can with the resources and tools that we have. So thank you for being here today, and thank you for being open to learning more so that you can do better by your dog. And I promise you, they will thank you for it. Amy, you're muted still.
Sorry. Thank you, Emily. So in summary, throughout this presentation, we shared why it's important to learn how to speak dog in order to be a safe and efficacious AAI provider. So whether you're conducting animal-assisted activities, animal-assisted therapy, or animal-assisted education. Dog's first language, again, is body language. So speaking dog means really objectively being able to understand what it is they are saying, even if it means letting the dog lay down when the client really wants to hug the dog. This is so important because when, again, we are our dog's only advocates. So without us, then who? When dogs did not ask to be a part of the job, they did not ask to be a therapy dog. They are doing the job because we asked them to. So advocating for them, understanding what they're telling us, not only strengthens our relationships that we have with dogs, but makes the animal-assisted interventions more meaningful. Additionally, as Emily presented, using humane training methods also helps establish us as predictable and loving pet parents, rather than the authoritarian and unpredictable parents. Sure, dogs may and often do respond and may perform as we'd like using the aversive methods, but it comes at a cost. It also sends a message to the client that we may not intend to send. We thank you for joining us today and appreciate that you included this webinar and training in your continuing education plan. And we hope to see you at additional continuing education sessions in the future. Thank you.
Wow, thank you so much, Amy and Emily. That was fantastic. I wanted to say before I forget, and we open it up for Q&A, is that, so a couple things. One is that I will send out the PowerPoint to everybody. The second thing is that I'll also send out an invitation to do a quick assessment of this webinar. And it's just a quick survey link. It's really important, whether you're taking this for CE credit or not, that you take a minute to complete that, because the HAI section is underneath the Division 17, which is the Counseling Psychology division of APA. And they're the ones that look at these evaluations. And we want them to know that this information is really important and valuable. And so, so take a minute to fill that out. If you are doing this for CE, what will happen is that you need to fill that out first. And then when you end with that, it'll send you to another link where then you need to put all of your identifying information. So your name and your address and stuff like that for me to be able to give you CE credit. Your name is not attached to, that's why I set it up that way. So your name's not attached to the evaluation at all. So I think what I want to do now is open it up for Q&A, and the way that we're going to do that with this large group is just to take a minute and type out your questions in the chat feature. So down on the bottom of your screen is a little chat icon, and so if you will type those out, then I will ask them of Emily and Amy. So I'll give everybody kind of a minute to do that. So, yeah,
Lori, can I just add one more thing? Oh, okay, sorry. I just wanted to let everyone know that Amy and I are offering an online course in dog behavior and training for AAI professionals. That obviously goes into much greater detail about these topics and more. It's a 6-week certificate course offered through Oakland University. Our next course is full, but if you're interested in joining us next time, you can sign up to be notified when that next one is open for registration. And that's the wait list here. And I will actually copy and paste that into the chat so you guys can just click it right from the chat. And I just have a few more additional resources. And like Lori said, we can send this out to you afterwards so that you can click these resources and learn more about a few things. And then I'll go through the references. Had lots of references that you guys can check out. And then, cool. Thank you, Lori. I appreciate that.
Awesome. No, thanks, Emily. And yeah, that would be great if you could put that link in the chat. That'd be super. I think a lot of people are going to be interested in that. So, so looking at any of the questions, so somebody asked about ways to objectively measure dog welfare in AAI. Could one of you speak to that?